Welcome, dear viewers, to our format Natural Medicine. Today I have the great pleasure and honor of having an exceptional physician here in the studio. He has traveled to us from the Saarbrücken region, and he is someone who does a few things that I have never heard of. Today I am hearing for the first time about gold implants that are actually able to neutralize, harmonize, optimize and rebuild joint bones that clash and cause pain so that one can walk pain-free. He's also known in the environmental field for RESE, which deals with environmental poisoning. I am very pleased to speak with him today on this topic of silent inflammations and see how far we can get. Stay tuned, we will start shortly. Now I would like to warmly introduce Dr. Harald Burgard. Thank you very much for your journey and your trust in us.
Thank you for the invitation, dear Alexander.
My pleasure. In the lead up to the meeting, I've developed more and more enthusiasm for you. There are doctors who simply continue to develop and further their education tremendously. The university is one thing, but what comes next are so many components. And you also acted as president of the Gold Implant of this association. Is it an association?
It's a society for the training of doctors for gold implantation.
Okay, and you founded it, where you're now presiding. This gold implant interests me a lot, but let's start talking about these silent inflammations. That's this silent inflammation, it's called, I think, over and over. And is it recognized in conventional medicine that this topic exists?
Yes. So in conventional medicine over the years, we've seen that there are silent inflammations. We learned in training that there are acute inflammations. Yes, that's known. You hit your thumb, it swells up. Yes. Or you have an inflammation in the tooth and it is acute. You find that immediately. You can also see it immediately in lab values. Then the blood thinners are high, the white blood cells go up, CRP and so on. With silent inflammations, we have a different problem. First, we haven't learned to diagnose them. And secondly, they are silent. And because they are silent, they fly under the radar and you don't notice anything.
Only when it becomes chronic and causes pain, then it is...
Yes. When it causes acute pain and rises quickly, then everyone notices it. But if you have silent inflammations, you don't notice them, they don't necessarily hurt. Yes, think of the silent inflammations in the blood vessels, which eventually cause arteriosclerosis. You don't notice it. Sure, at some point you notice it when you have a heart attack. And then they say, oh, that came out of nowhere. It never came out of nowhere. It developed over 10, 15, 20 years. And we can see that very early. So back to the question. In conventional medicine, we know chronic silent inflammations do three things. Vascular calcification with all its consequences, arteriosclerosis, high blood pressure, heart attack, stroke, diabetes, and even cancer. What also comes into play are neurodegenerative diseases, because we know every inflammation in the body also leads to inflammation in the brain. We have a significant increase in Alzheimer's, Parkinson's, and others, MS, but also chronic fatigue, concentration disorders, early dementia and such things. And hormonal disorders. Hormonal disorders are also triggered by this. We know that today it can be explained very accurately. And above all, you can also prove it very easily in the lab if you know your way around and know what to look for. A simple example. Often, patients come with chronic inflammations and their white blood cells are slightly elevated. Noticeable for us doctors are levels above 10.5. This is a value that means 500 leukocytes per microliter. But if they're over 6.8, it is always a chronic inflammation. Because whenever I treat these people and eliminate the causes of chronic inflammation, they return to the normal range. This is just one of many values you can look at if you know what you're doing. Or in serum electrophoresis, if the alpha-1 or alpha-2 globulins or the beta globulins are high or slightly elevated, these are always signs of chronic inflammation. The thing is, these values are often only slightly elevated. And when 4, 5, 6 are slightly elevated, then the fire is burning. And you know the difference between an acute fire and a smoldering fire. An acute fire, you can see it, you can smell it, you get some water and pour it on or call the fire department. With smoldering fires, by the time you notice it, it crawls under the floor here, then it might flare up somewhere else. And by the time you notice it, a lot has already happened. And these are exactly these smoldering fires, the chronic inflammations that cause vascular calcification, that cause cancer and much more. And why this happens can be explained very well.
Wow. But actually one should make sure that as few people as possible have any smoldering fires. That would actually be the preventive measure. So if so, I remember Otto Warburg who said every disease comes from acidity. Acidity is also a lack of electrons. That's actually the beginning of a smoldering fire, right?
Yes, over-acidity is often also a consequence. It is not only the beginning, but also a result. With every chronic inflammation, there is also over-acidity. And what chronic inflammations do? Well, that's very diverse. On the one hand, it's obviously the personal stress you have in life, but chronic inflammations also simply arise due to the environmental toxins to which we are exposed. We indeed find in our patients, when I pull toxins out of the body through blood washing, we see pesticides, we see insect repellents, we see PCB solvents, we see gasoline fumes, we see paints and varnishes, we see heavy metals, but we also see pathogenic burdens, which we cannot even detect in conventional medicine, because they are chronic, because they are not acute. Under the radar, we see Lyme disease, toxoplasmosis, we see various viruses that are active, that were never there, but are still there. And in total, this makes people sick. And in my opinion, this needs to be detected early, or if someone has complaints, then found and eliminated.
But now, the problem is that the silent inflammation is not actually being searched for, because we feel okay. But the slow burn is there. So that's already a bit of a silly thing, right? The snake bites its own tail. So actually, I should have a preventive examination once a year where these values are determined through the blood, these leukocytes.
Yes, we do. The patients usually come to me when nothing works anymore. So the people who come to me usually come with 2 binders full of examinations from who knows where, because they are suffering from ailments.
That's me. They already identify with the values, don't they?
Exactly. And often they are really seriously ill. They come with chronic pain, they come with Parkinson's, with whatever. It would actually be much better if one pursued prevention, like taking the car to the tooth every 2 years so that the axle doesn't break. You just go to the doctor and say, look here, where do I have risks? What can I do now so that a heart attack or cancer doesn't develop in 10 years? You can prove that very precisely today. One can already intervene in many places today. I recently attended a very interesting multi-day seminar where there were professors researching Parkinson's, Alzheimer's, and so on. They said we can, of course, see which substances form in the brain and cause damage. But with all the medication trials we have undertaken so far to stop this, we haven't made any progress. Where we do know we have a big lever is in eliminating environmental toxins, burdens from pathogens and toxins early on, so that the spook ends and doesn't even arise, or simply avoid the stuff where possible. But first I need to know what is making me sick.
That's where the topic of environmental doctors comes in. We do a lot of environmental medicine, but the environment isn't really a big topic in medicine. In Switzerland, the title environmental doctor doesn't even exist.
In Germany, we've had the environmental doctors for decades, but it's more about looking in workplaces to ensure that the toxic load is not so high that people die immediately. However, if you were to lower the limits in workplaces to the levels we consider important in clinical environmental medicine, it could shut down 80% of businesses in Germany. The problem is that we simply become ill from chronic poisoning. For example, I often hear from insurance companies that the patient's lead exposure is irrelevant. It's not high. Yes, that may be true. But if someone becomes ill, you have to look at various things. Assume you come to me as a patient, you now have a chronic illness. Why do you have it and not someone else? There are various reasons for that. First, your genetic component. Why do you come in with a heart problem? Because in your family, people may be more prone to cardiovascular diseases than in other families where one might instead diabetes gets, or rather Alzheimer or something like that. This is genetics. Then it comes to how does your body react individually to stress? There is, for example, the genetic level of inflammation. A substance enters your body and you react normally, level 0. Or you react so excessively, for example, level 4, like a car that goes full throttle in the city center and the brakes are broken and it crashes fully into the wall. Then you look, okay, what kind of stress do you have? Are you currently still taking toxins, for example, from substances like lead, cadmium, mercury, or something similar. I can see that in the blood. Or do you no longer have a current recording, but did you record this years ago and have a large amount in the body? I can see that from other things like urine, for example. Then you can check, how is the intestine? Is it okay? Is the intestine leaky? Do you have a permanent passage of toxins into the body, which burdens the immune system, burdens the brain? And that way, you can figure out why you are sick and not someone else. And these are diverse reactions. If, for example, I now have someone who comes and has lead poisoning. I've never seen, for example, someone with rheumatism or fibromyalgia syndrome without lead or cadmium poisoning, regardless of whether it's a child, a teenager, or an adult. Sometimes these can be small amounts. Someone comes in and has an entry of, 200 micrograms of lead during excretion. One often says, well, that's not much. Toxically speaking, in terms of toxic reaction, that might still be true, but every toxin that enters your body triggers a toxic reaction. It has a reaction on your immune system, so there is an immunological component, and it also affects the hormonal balance. This means we have 3 different effects, but we often only consider the toxic effect and say, well, if he now has a huge amount of lead in his blood, then he can't possibly get sick. That's nonsense. And when 2, 3, 4, 5 substances come together, then nobody really knows if 1 + 1 + 1 equals 3, or if it's 5, or if it's 20. Yes? That depends, for example, on how you individually react to exposure. Whether you overreact or respond normally, all this can be measured.
You just mentioned cadmium earlier. I heard about that once. It also comes out the back through the exhaust, right, from cars?
Yes, partly from car exhaust, but also from cigarette smoke. Cadmium is also present in other industrial emissions. We had lead for decades, of course, in leaded gasoline. And we all inhaled that, but children and teenagers today no longer do. Interestingly, children and teenagers have significantly more tin in their bodies, which comes from clothing dyes, from color fixatives. And they absorb it, they run around, they sweat, they take it in through their skin, which compared to our growing bodies is a larger surface area. These are all substances known to be carcinogenic, for example. All divalent metals like lead, tin, nickel, mercury.
Mercury. I heard something about that last week. I can hardly believe it. Most nasal sprays and eye drops contain mercury. However, it's labeled differently. It's a generic term. And there I thought, this can't be real. What else do we have to pay attention to now? It's said to be in there to reduce or stabilize the oxidation of the drops. That's just not possible. So nothing is sacred to us anymore, right?
Well, mercury is highly toxic. I often see that silver is used to do such things. I wouldn't want to have too much of that in my body either.
But as a consumer, I can't read what's written on it. I have to trust what the pharmacies or the doctor give or prescribe. But even in tablets, be it in capsules, such things are often still packaged and included that one must say, I don't understand the world anymore. We're basically just destroying ourselves. So the procedure is silent inflammation. We have an incredible number of components that promote these silent inflammations. And if we are aware of this preventively, we can actively do something by simply having these values determined. And doing what's necessary, that means the dirt has to come out. And I know you have a picture with this bag showing everything that comes out. You couldn't even push that through in the PowerPoint presentation so that we could see the picture. It was right at the end because it's so fascinating what all comes out. And you also analyzed that in the lab, what's in it from this blood wash.
So when we do apheresis to remove environmental toxins, we usually take the arm veins. That means the patient lies there quite comfortably with a needle in the right and left arm vein. If the veins are very, very bad, then I sometimes go down here into the groin. With ultrasound control, it's also a small thing. It's something that's not really big. You just have to know how to do it, but then it goes well. And yes, then over the course of 1.5 to 2.5 hours, depending on the size of the patient, we extract poisons. And what you see in the bags is the pure eluate. That's what we remove in terms of liquid poisons that are protein-bound, not protein-bound, fat-bound. There are also pathogens in there. There are also protein complexes. Here, for example, you can see
at the very bottom, it's dark, right?
Later I also have a video with me where you can see it clearly when you look back and forth at what kind of dirt is in there. Yes, normally it has to be completely clear and transparent. Here you can see all sorts of spots.
And then you send it to the lab, and what do they say it is?
Yes. So we send it to the lab, and then we have it analyzed to see which poisons are in there. And you find everything from insecticides, pesticides, to paints, varnishes, coatings, all sorts of things. But what you often find are the so-called circulating immune complexes. When normally a toxin or a pathogen known as an antigen enters your body, the body responds by producing antibodies. This is well known now due to all the corona stories. And this antibody binds with the antigen to form an antigen-antibody complex. And this complex is then devoured by macrophages or phagocytes. Unless this happens constantly, then eventually they become saturated and can no longer digest them. And then these things deposit themselves in blood vessels, in tissues, on cell membranes, on muscles, wherever, and cause permanent inflammation there, can trigger pain, can cause chronic inflammation, can make you really sick. And we also measure these circulating immune complexes. And they are sometimes incredibly high. The sicker someone is, the more we often see these immune complexes. And sometimes even during repeated tests, that they even continue to increase in part until you have them mostly out. But we also find viruses in the eluid, for example. We can extract bacteria. We find Borrelia. We find toxins from heavy metals, for example. We find toxins from molds, for example, and much more. These are all things that can be detected. Naturally, we also find a lot of heavy metals, and I always prove it. Generally, with every patient, so that people can also see, what do I really have? What comes out of it? Is this just a nice picture with a few different colors? Or is there really something in it? Here, for example, you see on the left this red-colored eluate. That is, for example, one with a lot of heavy metal, with a lot of metal content. Sometimes people come who have chronic inflammation because they have a massive amount of iron in their body. Whenever you have an inflammation, the body says, my God, I have to push my iron into storage because I need iron for oxygen supply in the body. So, for life, for survival. But if this constantly happens, and then these iron stores rise and rise and rise, then the iron alone already causes inflammation. And the high amount of iron, for example, you can see that it also becomes reddish, and it needs to get out. Of course, the causes have to be eliminated too, lead, pathogens, Borrelia, and so on. But it can look like this. Down here, for example, you can see at the tip, it's dark. That's metal. Or here you can also see what's heavy falls downwards. So someone who has a lot of metal usually has a dark tip down there. Here you can see it even more clearly. And it becomes, when you do multiple apheresis, lighter over time and disappears.
So it's actually unbelievable. Unbelievable. So doing this once is actually sensible for everyone. I think we have all been confronted with countless burdensome substances, and that these trigger inflammation cascades or start immediately is actually clear. Not everyone reacts immediately the same, because we have different detoxification capabilities, very individual, but it's a big source. And dear God didn't put these things in our bodies, rather we introduced them ourselves.
Well, it's just that we are normally equipped to detoxify what we ourselves produce as waste. Urea, uric acid, and various other things. Now, we live in an environment where we, I would say, are now exposed to around 350 zero toxins. And your body also has to detoxify them. It can do that to some extent, but if we talk about metals, like lead, mercury, etc., we know that 50% of people don't have the enzyme glutathione S-transferase mono, that's what it's called, which we need for detoxifying metals. That means half of the people don't have this enzyme at all. And they just store the stuff. These are the patients who come to me at some point and say, I'm sick, I don't know why, I have constant pain somewhere. Then you find high lead exposure. Why lead? Why does lead cause pain? In rheumatic patients, it's simple. Because of molecular mimicry. Because the body thinks lead is similar to calcium. And when lead is present, it takes lead and stores it there, where normal calcium is found, in the bones or in muscles. When your muscle contracts, you have in every muscle cell a kind of tube that is full of calcium. And with every muscle contraction, calcium is released. If now, instead of calcium, there is also lead and lead is released, it causes inflammation in the muscle. And that's why we find in rheumatic patients, in all this fibromyalgia, etc., high amounts of lead or also cadmium. Cadmium is also known to cause bone and muscle pain. And there are even Ita patients. Ita means ouch, ouch in Japanese. At some point, a big corporation had an accident and a lot of cadmium got into the water. And it then, of course, poisoned the fish. And when it passed from the water onto the soil, it naturally also contaminated the vegetables. And the people suddenly had severe pain. They screamed from the pain. And it was found that they had lead poisoning. It was found that they had cadmium poisoning. And since then, it has been known that cadmium causes muscle and bone pain.
That also contradicts me. I know so many people with fibromyalgia, and it's always said diagnosis unknown. So you have to live with it, can't do anything about it.
Yes, that's wrong. That's definitely wrong.
Yes, but it's just said.
And it's also always a mixed exposure. You can basically forget that someone comes and they have a chronic illness and it's caused by one thing. They don't come in with just bleed. No one comes and says, I received a contrast agent with gadolinium and became seriously ill because of that alone. That's always the icing on the cake that makes the heart overflow. People always have a mixed exposure. They come in with something like rheumatism, for example, to stay on the topic, have chronic pain, and I find lead, but also cadmium, and usually also active toxoplasmosis or active Lyme disease or Chlamydia trachomatis. These are all pathogens that cause muscle pain. Almost always you find a mix of many such things. You just have to find out. We do a Desasset-Page questionnaire for every patient. I look at all previous findings. I examine the people so that you know what kind of person is in front of me and what has already been done. And where I see gaps, and then I look at the gaps, and then you relatively quickly figure out what's going on. And then you do analyses or do apheresis with the removal of environmental toxins to find out what is going on. And then I know how to get the person healthy again. We can't do magic, but we can take out the maximum load and then lead to the point where the body doesn't heal itself. Because the self-healing powers, they are enormous. It's always amazing to see what then happens in the organism when the dirt is out.
We came up with a few thoughts up front where you had said that many people don't have this glutathione something. I keep wondering if the state really cares about the health of the people, then this would be something very, very significant to find out who can't do it and to support them accordingly so that they are less burdened with such toxins, because they are certainly going to get sick faster than the others.
Definitely.
And on the other hand, I also wonder, there are healing possibilities, approaches, holistic ones. Of course, the causality is not there. I take this and get this disease. There are multiple components, but experiential medicine like yours and also from dozens of other exceptional medicine show that when you look at it all together, you have a solution. And I simply think these solutions must be brought more broadly to the viewers. There is indeed a need for hope.
That also depends a bit, I believe, on how our system is structured, our healthcare system. The colleagues are not any less intelligent than I am. They are at least as intelligent and as well educated as I am. But the problem is, we've all learned to first look at the acute things, and then a doctor's office, a practice within the health insurance system, gets 30 euros or 50 euros per quarter for a patient. You have to treat a certain number of patients for it to make sense financially. It is, after all, a business. You have your costs, your staff, and so on, and then there's a structuring. In German medicine or in other Western countries, we are organized in such a way that we mainly work with medications. Or, of course, in acute medicine with operations and so on. That is indeed okay. It is also very helpful for people who have certain diseases. Only in the chronic area, that's where it just falters. And we have been seeing for years that the numbers of chronically ill people are simply increasing. And we try to solve the problem again by giving tablets, by giving remedies against Parkinson's, so that more dopamine is formed. Or by simply implementing immunosuppressive measures with cortisone, with MTX, with other things in rheumatism or other autoimmune diseases. You can do all that. Only if I have someone who, for example, has chronic Lyme disease or toxoplasmosis or lead poisoning, doesn't help much if I give them cortisone or MTX. Then I can suppress the pain, but the damaging process continues. Because the pathogen defense doesn't occur. That cannot be stopped. I have seen this in patients for years. And we simply address the causes. it is always important for me when a patient comes to check what they have, what makes him sick, and not his brother or anyone else, but the one sitting in front of me, and then proving what it is and removing it as best as possible, because then the person has a real chance once the stuff is out to firstly halt the process, whatever disease he has. Secondly, regeneration will eventually set in, and sometimes it's fantastic what happens. As I said, I can't perform magic either, but I can ensure that what we detect goes down so much that inflammation levels normalize and that many other things normalize as well. And we think, for example, of chronic inflammation sequelae and also of cancer. We simply see that a lot of people are suffering from cancer. What happens in chronic inflammation? We have two large groups of cells that are capable of warding off tumor cells. These are the so-called MHC cells and the natural killer cells. We know, medically known, that any inflammation suppresses the formation of these two cell groups. That means they do not form in the first place. Or, in the case of natural killer cells, for example, they are there, but they are not active. Translated. That means you either have no soldiers for defense or soldiers without weapons. Neither is effective if you want to kill cancer cells. This can be measured. These are simple laboratory tests. And then I see when a patient comes, for example, with tumors, when I go and remove the causes, so these diverse inflammations, that then the natural killer cells rise again. And we have patients who simply live with metastasis for years. And it escalates. And these are things that are known. They can be measured in the lab. It's not rocket science. It just has to be done. This is more effort than giving a tablet. No question. It also takes time. I can, of course, manage that quite differently in private practice than a colleague who has to practice insurance medicine, because I simply have more time for the patients. But that is sustainable and that is also helpful for the patients.
We have to slowly come to an end. With fibromyalgia, where you speak, the word was still pronounced incorrectly. I always included the word toxoplasmosis from you before. I also believe that this causality is often present. People do all still have a cat at home, but that's also one of those topics where you don't really pay attention to the possibility that this toxoplasmosis might be contributing to the outbreak of this disease. But I've also heard that from you. Also in other contexts already. I'm very pleased. Now, once again, let's move on to silent inflammations. Which parameters would you recommend for the viewers to have determined by their doctor? Is that too much, or is there something you can recommend?
There is a multitude, and not every doctor can do it easily, because the blood sampling is one thing, but also the preparation of the blood before it's sent to the lab is extensive. So we always determine first about 45 standard values, which means a complete blood count, CRP, so a highly inflammatory C-reactive protein, the sedimentation rate, that's standard. Then, of course, we look at the liver values and kidney values. We always do a serum electrophoresis to see how is the protein breakdown. There you find certain protein diseases that can become dangerous. Plasmacytoma. In the year, I filter out 3 to 5 patients with that. If you treat it early, you can prevent it. But you can also see if there are chronic inflammations. And then there are special values such as lipoprotein, PLA2, that is LP-PLA2, to see if the inflammation is in the blood vessel or ANCA, antibodies. So it's a huge list.
I understood that I can't understand what you're saying right now.
That's difficult.
Okay, so there's a lot, and I don't think it's that easy for you experts to read it. It also takes experience values to understand how one cog has to interlock with another to still be healthy or not healthy anymore. Yes, that was a very impressive first broadcast, dear Harald. Thank you very much for this information. I know we still have a lot to discuss. We haven't even touched upon all these gold implants, because that is truly something of yours, which in my opinion is still completely insignificant here on the market. But actually, every doctor should know that it exists, and we'll do the next show about it. Thank you very much, dear Harald.
You're welcome.
To you too, dear viewers. I can only appeal here to have it professionally examined, whether there are silent inflammations like flashpoints. How did you say it?
Smouldering fire.
Smouldering fire. Yes, such a smouldering fire, and to act in time, by the way, changing dietary habits, actually for all of us immediately would pour a little water on the fire, wouldn't it?
Well, if you eat well and, for example, have enough omega-3 fatty acids, you could also reduce silent inflammations. There are many attacks. Of course, that's a huge topic, but that's part of it.
But it's clear to me once again that this recommendation doesn't naturally come from you medically and tendentially. That's why it's important for us to document it here. Yes, that's it for today. I wish you all the best until another time, and goodbye to everyone.